My name is Jonah Nagel, and I'm going to be talking about a pretty common condition that is seen in a lot of chiropractic offices called a disc herniation. Now, in between your spinal vertebrae, you have these intervertebral discs, and if those discs that get damaged due to some kind of trauma or could be pathology related or anything, the disc is going to kind of slip out from in between these spinal vertebrae. Now, these are most common in the lower cervical and lower lumbar vertebral regions, and there's 4 different types of disc herniation. You have a bulge, where the annulus or the outer ring of that disc is still intact, but it does extend outward. Now, those are the least worrisome of the 4. Next, you have a protrusion, where the annulus gets weakened and the nucleus pulposa, which is that internal part, pushes against the weakened annulus and extends out, where the base is wider than the dome of the protrusion. And the next worst is the extrusion. A disc extrusion is where the annulus is ruptured or broken and the nucleus pulposus breaks through, and then now we have the dome is wider than the base at the origin of the disc herniation. And then the last part is a disc sequestration, which is where you actually get a fragment of the nucleus material that breaks completely free, and you'll see that just kind of floating in there, separated from the whole disc, and that's the most worrisome. Now, what these can do, they can lead to a lot of things, but I'll explain what radiculopathy is, which is where this herniated disc material is going to press on these exiting nerve roots, and then that can cause all kinds of things, all kinds of issues that follow that specific nerve root in the dermatome pattern. So you can get radiating pain. This nerve root up here is radiating down to the ulnar nerve dermatome or whatever. Then this pain, even though it's a disc thing, it may radiate down into this, extremity. You can get numbness and tingling are pretty common. Muscle weakness, the damaged nerve root can affect the muscle's ability to perform motor function and strength. And then you can have diminished and absent reflexes at the side of that. Now, you can do tests like orthopedic tests and neurological tests to identify if we might have a disc herniation, like a straight leg raise, Kemp's, Sperling's, or cervical tests, depending on the region of what we are suspecting may be the issue. Now, if we do suspect a disc herniation, or we've proven one with imaging, and we start seeing progressive or severe motor weakness that's not getting better with treatment, the treatment is potentially making things worse, or we're seeing things like sidle anesthesia and bladder changes, those could be indicative of something more serious, like maybe possible Cauda equina syndrome, which is a surgical emergency. Now, for disc herniations, the most common imaging options the gold standard is going to be MRI. The MRI is going to show the best structures and everything as to what we're looking for. X-ray, you're not going to see the disc material directly. CT could be used if there's a contraindication to the MRI, like someone has a pacemaker and they can't do an MRI. CT could be used, but it's not going to be as good as an MRI. Now, treatment options in a chiropractic firm, that's going to be conservative care first. So chiropractic adjustment is a great conservative option for treating disc herniations. Now, flexion distraction techniques, there's therapeutic exercises and rehab, soft tissue work like electrostimulation, more traction, and then just activity modification and patient education. Like I'm saying, in a chiropractic office, we're going to be doing conservative care. If none of those are helping, we're probably going to refer out, because it's going to be probably something that is going to have to be handled outside of our scope of practice. And yeah, I think that covers just about everything. I'm reached my time limit.